Hello beauties, Nikki here, Director of Skin Envy. Today I'm going to take you guys on your treatment guide. We're going to go over all of our Beauty Bash specials, all the hottest treatments, tips and tricks and information from our professionals, and so much more. Grab a drink, get cozy, and let's hop into your treatment guide. All right, so we are gonna kick off our specials with some injectables. Now, I'll let you guys in on a little secret. All of our toxins are $9.99 per unit if you get 100 units or more. I know that'll get you excited. Let's hop in.
Neurotoxin is otherwise known as Botox, and it works on the muscle in the face. It can be injected in multiple areas of the face to help relax muscles and reduce wrinkles, and on average it lasts 3 to 4 months.
we are not done with injectables just yet. Stay tuned to hear Injector Mary talk all about collagen stimulators, and Injector Carly will fill us in on the PRP and PRF 411. Let's get into it.
Biostimulators boost your body's own collagen to build volume, restore dermal thickness, and give you a youthful, healthy glow to the skin.
Carly, what is PRP and PRF?
So PRP is platelet-rich plasma and PRF is platelet-rich fibrin. So both PRP and PRF help to use your body's own growth factors in order to induce new collagen growth, elastin, and even hair growth.
I'm just dreaming about all the things that I want. Cheek filler, lip filler, maybe a little Botox, who knows? But hold on, there is still more. Let's jump into aesthetics. Let's talk about all the hottest skin treatments, from facials to lasers to microneedling. We have it all. Let's jump in. Let's talk about aesthetics.
Hi, my name is Christina. I'm a medical esthetician here at SkinEnvy. The HydraFacial is a medical grade treatment. It cleanses, detoxifies, exfoliates, extracts, and hydrates all in one. It's appropriate for all skin types: normal, oily, dry, sensitive, and aging. It helps with fine lines and wrinkles, hyperpigmentation, and pore size. Call us today to get your HydraFacial scheduled.
I am so excited for this one. So Cool Peel is truly one of our hottest treatments. Everyone loves the Cool Peel. The results are just phenomenal. Let's dive in and let these before and afters speak for themselves. Jill, what is the Cool Peel laser?
CO2 is a resurfacing laser designed to improve the appearance of the skin.
What does Cool Peel help with?
Cool Peel helps with various conditions such as fine harmful wrinkles, skin texture and tone, pore size, and type.
The Modos AC is the latest technology in lasers. We can do many different treatments with the Modos, including laser hair removal, vascular lesions like rosacea or broken capillaries. We can do pigmented lesions like brown spots or sun damage. And we also can do skin resurfacing as well, and it's painless.
Christina, what is Thermage?
Thermage is a treatment that uses radio frequency to help tighten up skin laxity.
Let's take a live look at this demo and how Thermage is really done.
Tatiana, what is Clear and Brilliant and how does it work?
So the Clear and Brilliant is a gently surfacing laser. The cool thing is that we can completely customize it depending on your skin's needs. One hand piece is going to help stimulate collagen, help with texture, fine lines and wrinkles, and pore reduction. And then the other hand piece is going to help address any discoloration, sun damage, and melasma.
Marie, what is Virtue RF and how does it work?
Virtual RF is a combination of microneedling and radio frequency energy to help with laxity, fine lines, wrinkles, acne scarring, all signs of aging.
All right, well, we only have a few minutes left of our treatment guide before we jump right into our live Q&A event, where our professionals will spend about 30 minutes answering any and all questions you have after this Beauty Bash treatment guide. Let's dive in.
Microneedling is the best for collagen reproduction, helps with fine lines, wrinkles, pores, and texture.
We've saved the best for last. Not sure what to get after this treatment guide? Let our CEO and founder, Kaisa Marshall, explain to you the beauty, the art, and the importance behind our consultations here at Skin Envy.
Hi, I'm Kaisa and I'm the founder of Skin Envy and an esthetician as well.
And I do the consults here. We start your consult with a Vizia skin analysis. It's an expensive state-of-the-art camera and computer system that takes into account your age, your sex, your ethnic background, and the color of your skin. Then it compares you to other people with those same characteristics. We then get a score and the machine tells you what it thinks is a priority for you. We also do it the old-fashioned way, where you tell me what it is that you would like improvement with. We have so many different treatments and modalities here at Skin Envy that we find it takes an hour consult to go over with you every single one, what they can and can't do. That way you can make an informed decision on what's going to be best for you. We can make a year plan for you, or it can be a 3-month plan, whatever works within your time frame. We always like to work with your budget, with your time, and your downtime. We know this is an investment for you, and we want to take the time for you to make an informed decision.
Kaisa, why choose Skin Envy?
Well, we have been in business over 16 years and we have an amazing team of caring and professional practitioners who deliver noticeable but natural results.
Hey guys, this is your SD Bestie Bailey. Your skin deserves the best. Protect your investment with medical grade skincare. Now's the time to stock up with 20% off all retail products.
Now I know we went over a lot of information, but stick around for a live Q&A and we will have our professionals answer all your questions. We have our aesthetic nurse injector Jill joining us with over 10 years of experience in the aesthetic industry, as well as Carly, who is our nurse injector here at Skin Envy with over 8 years of experience, and one of our master estheticians, Tatiana, who has over 5 years of experience in the aesthetic industry. Let's get those questions answered. Hello guys, well wasn't that just so much fun? So I'm sure everyone has so many questions now after treatment guide. So we have our professionals here that are ready to jump in and tell you all about the treatments, answer any questions that you may have. So I am going to pass it over to them to explain and answer any and all questions for you guys. So let's see here if we have everyone on. Jill, Carly, and Tati, let's see if they're connecting. Can you guys hear me? A little technical difficulty. We can hear you, but we can't. Oh, we had you there for a second. Let's take a look. Bear with us for just a moment, everyone. Let's see what's going on. looks like they're still cutting out. Let's give it a second. Let's reconnect and see if we can get them back on.
I paused it so you're good.
Hopefully, it's you figure out all the glitches.
Yeah. Can you hear us, Nikki? We are good.
Okay.
Yes, we are back in action.
Love it.
Okay.
All right, so I'm so sorry for all that technical difficulty. So we do have a few questions already coming through, but Jill, if you just want to touch on what the downtime is for Cool Peel.
Yes, so the Cool Peel Blef is actually a CO2 laser, so it is probably the most amount of downtime as far as lasers go. I would estimate around 5 to 7 days of downtime. The biggest downtime factor is swelling, so you kind of have to anticipate and plan for that. I would say it starts to improve on day 3, but plan for approximately 5 to 7 days of complete downtime for something like that. And definitely the winter time, when it's a little bit cooler, is a better time to do a procedure like that. If you have other questions, just please feel free.
Yeah, perfect. So I'm going to roll out another one that we have here. And it is, are there any side effects or risks associated with Sculptra?
You want to touch?
Yeah. So the biggest risk that you'll hear about with Sculptra are like things like lumps and bumps after treatment. Honestly, with us, it's very, very rare. I personally have never seen like a true nodule after Sculptra. A lot of that is because of the way we mix our Sculptra. Adding some more sterile water over the years, we've learned it really reduces your risk of those issues. And then also massaging after treatment is very important. So we always educate every Sculptra patient with 5 days after treatment, 5 times a day for 5 minutes every time. You want to massage the face. And we always show our patients that first massage after that initial treatment. So you feel like comfortable going home and doing your proper post-care. Other than that, after treatment, expect, there's always a potential of bruising, and you will have some swelling immediately after treatment. Most of that swelling is going to be the first 48 hours. Specifically, most of it's the first day of treatment. But other than that, we do everything to reduce your risk of bruising and all that. But just expect a little bit of downtime after treatment, just to be on the safe side.
And then the only other thing, just to chime in on the tail end of that, anything, if you have any autoimmune disorders, that's sometimes a little bit tricky in that sense, but that's something your practitioner can talk with you about going forward if you're a good candidate or not for that particular treatment. But Sculptra is pretty amazing, I will say.
It's one of our favorites here.
Yes, one of our favorites.
It definitely is a popular one. And to kind of tie into that, what do you recommend, or where do you recommend getting Sculptra, and how many vials typically? This was another question that someone just sent us in.
I think I would say pretty standard would be starting with 2 vials for most everyone, unless you're really getting ahead of the curve and you're in maybe your early to mid 30s. Sometimes we can get away with 1 vial a year. But usually about 2 vials per year is pretty standard. I would say for most people, the greatest perk about Sculptra is it's very customizable. So meaning each time you're getting a treatment, it can be placed in various areas. Deeper along the temple, jawline, cheek, the nasolabial fold area is pretty popular for Sculptra. Even kind of building out the perioral or chin shadow is great. So the practitioners, we all are very well versed in kind of customizing Sculptra for everyone. So you can't really go wrong with 2 vials. Most people can handle 2 vials pretty consistently, I would say. It'd be more on the conservative side if you were early to mid 30s, maybe one vial would be a little bit more appropriate if you didn't need temple or something like that.
Definitely. And to kind of tie into that, and we'll stop it there for the collagen stimulators because there's a lot of questions coming through, and then we'll jump into some other things. But I do think this is a really good one. Is Sculptra and Radiesse the same, and how do they differ?
No, they're not the same. They're both biostimulators. So they induce collagen production in the skin. They're just two different types of products. So Radiesse is going to be a calcium-based product, and then that we hyper dilute. So we take that syringe, and then in order to make it like a biostimulator, we mix it with some sterile water. And then with Sculptra, that's going to be PLLA. It's just a different type of product. And both what they do, though, when we inject them into the right plane, I always tell my patients they're like fertilizer for building collagen in your skin. So we're kind of just tricking your skin into building collagen that it wouldn't necessarily have on its own.
Perfect. I love it. All right, ladies. Well, let's see what other questions we have going here. We are getting tons and tons through, so bear with us. We will try to get to all the questions, but obviously if we can't, we will definitely take these under consideration for future videos and so forth to kind of give you guys more information on these. But let's kind of jump in and talk a little bit about Cool Peel again, because I know it cut us off in the beginning. So we have a question here from someone that says, what can I expect in terms of discomfort and pain during the Cool Peel?
Well, everyone's a little different on their pain tolerance. I will say we definitely numb you with a topical numbing, which lessens quite a bit of the initial discomfort. The benefit is that it's very, very fast. So that helps with the pain threshold. The treatment is pretty quick. We also have the capability to blow cold air simultaneously while doing the laser. And then if you're really nervous, really scared, or have a low pain threshold, we also offer Pronox, which is a nitrous oxide gas. A lot of people are familiar with that from the dentist, things like that, that help sort of lessen those pain thresholds. So we definitely have everything to keep you very, very comfortable during the treatment. Unless it's a real intensive DECA pulse, which is a more intensive CO2, most people can tolerate it fairly well with just topical numbing, to be honest. Minus the eyes. The eyes are a different one.
We have all the goods to keep everyone comfortable. Kind of tie into it, but this is actually a great question. I love this. And it's, what's the difference between the Cool Peel itself and DECA? And how do those differentiate from each other?
Yeah. So both are CO2 lasers. So we're using the same laser for either, but it's different settings. So the great thing about Cool Peel is that we're able to deliver that same amount of energy in a really quick burst. So like Jill was saying, it's much more comfortable than, say, like a more traditional CO2 treatment. Typically your Cool Peel, you're going to be red and toasty after treatment, but it's very tolerable. I always tell people, if I can handle it, anyone can. I'm a mess. And it's very tolerable with all of the things that we do to keep you guys comfortable. And then when it comes to the CO2, pretty much that's going to be, we use that for deeper, like more signs of aging. So deeper lines, if you have like more pigment that we're working on, just
acne scarring.
Acne scarring is great for it.
For DECA.
And we're going to go in with DECA for that. And that's going to be, again, a little bit more intensive a treatment. We want you to have more downtime reserved for that, but amazing, amazing outcomes with both. But Cool Peel, you're going to look at like multiple treatments typically, whereas CO2, a deeper DECA treatment, usually it's more like
once a year.
Yeah,
I would say
you don't want to do that too often.
Perfect. I love it. Well, the questions are flowing. I feel like we almost didn't keep up. I'm like, oh my gosh. We have a lot coming in for Clear and Brilliant too. So I'm going to pass this one over to Tati. Someone here asked us, I have a question about Clear and Brilliant. Is there any downtime? Tati, can you explain the downtime and kind of how that looks for Clear and Brilliant?
Yeah, so the Clear and Brilliant laser is going to be like a low minimal downtime, especially compared to like a cool peel laser. This is going to be on like the low end of the spectrum as far as like downtime and recovery. Usually, I would say the first day is when you're going to be like a little bit red. For the next 24 hours, you're going to feel a little bit of heat afterwards, but usually that subsides like an hour or two after the treatment. And then on day two, you can be a little bit pink, and then by day 7 you're kind of completely back to normal. What I tell my patients is that the first couple of days you're going to feel a lot of dryness, almost like a sandpaper feeling to the skin, but you can wear tinted SPF, and that usually will kind of like, you won't be able to tell that you had like a major treatment done. And most people recover pretty quickly, so very minimal downtime with that treatment. So it makes it really nice for someone that doesn't have the time or the downtime to recover from a laser.
Perfect. I love that. And to tie into that, someone here is asking, how many sessions of Clear and Brilliant does one typically need?
Yeah, so it's going to vary from patient to patient depending on like what we're trying to target. Usually I always recommend a minimum of 3 treatments to start. So getting a package to kind of get you started and kind of see where you land after like a 3-month period. And then if we need to incorporate other treatment, or some patients will need up to 6 sessions. For example, someone that has melasma where it's a little bit more stubborn to treat, sometimes they will need more sessions, but typically 3 is like the standard.
Yeah, and I was going to say, remember that pigment is buried in the skin almost like a pyramid shape, right? So as we remove superficial pigment from the top layers of the skin, there's lots of fun things still dancing down under there that are going to keep working their way up. So there's a 10-year lag on sun damage. So everything we did in our 20s, see in our 30s, and vice versa. So sometimes that is a little bit of a learning curve to understand. Even if you look visually better, there's still stuff underneath there that is kind of working its way to the surface as well.
Awesome. Yeah, it's usually stuff that we're so unaware of, right?
Yeah.
We're like, okay, we think we kind of got it all off, and then all the damage is still underneath, right?
Yeah. That's the fun part.
The not so fun, but fun part. Fun for us, but not so much for our patients, right? Let's take a look here. What other questions we have? I do also have here, in terms of Clear and Brilliant, one of the questions is, can I get Clear and Brilliant while I have active acne? If not, what would you recommend?
Yeah, so Clear and Brilliant actually, when they first came out with this treatment, was to actually treat patients with acne. So we can safely treat over top active acne as opposed to like microneedling. Typically, we recommend that you don't have any like active breakouts because that can be the bacteria. But since we're not puncturing the skin with the laser, it's using heat and like a specific wavelength to go into the skin. It's safe over top of acne, and I find that a lot of patients, I actually see improvements in like overall like oil control and like the scarring and the texture and like the hyperpigmentation that comes along with acne. So that makes it a really nice treatment to do with patients that are having that. But sometimes I'll have them not necessarily start off the jump with the Clear and Brilliant, but maybe pre-treating with like a chemical peel or facials before we jump straight into like a laser treatment. I think at Skin Envy, we do a really good job of making sure you're on the right products and also pre-treating you before jumping into a laser, just to make sure that you're getting the best results with the laser.
Yeah, definitely. I think a lot of times we neglect the importance of actually prepping the skin, right? And I think that's something that is really valid to kind of just talk about and make everyone aware of, because it is so, so important to prep that skin with a chemical peel. Let's see what else we have going on here. I have a question from, let's see, Sydney. Do you recommend getting your lip filler dissolved and restarting if you have been getting, say, 1 to 2 syringes a year?
Well, I think it varies. A lip filler is a very tricky little thing. I think that anyone is prone to migration regardless of technique or product or anything like that. Depending on the lip anatomy, and if we do feel that there is a little bit of filler migration, meaning outside of the borders of your lip lines, we will typically recommend doing a session of dissolving or Hylenex, just so that we kind of start with a fresh palette. It happens to everyone. I've had my lips dissolved multiple times. Probably every injector, every provider out there has. So yes, it can be common. And if we feel in person when we see you, if we could make the best outcome for you, we will recommend doing a session or two of dissolving prior to restarting, if it's been a couple of years.
I do, and just to touch on that too, I think it's been a big like TikTok, Instagram trend with a lot of patients just are coming in and thinking automatically they just have to get it dissolved. And that isn't necessarily the case. So like Jill said, if there's duration, if there's things we're not liking, we can always start new and then re-inject and get you those goals that you're looking to achieve, but it's not necessary for anyone. So it's just really case by case, and that's where like a good consultation is really important.
Thank you, ladies. I love all that information. Who doesn't love to hear about a little lip filler? I feel like that's one of our hottest treatments, that's for sure.
Yeah.
Let's see what else we have going. So we have a question here from Allie asking, are there any safe treatments recommended for the summer, specifically living in Florida?
Yeah, so maybe I'll touch on like as far as like skincare treatments, there's definitely treatments that you can do. Living in Florida, it's kind of sunny all year round. Today's like the first chilly day. And so we're getting into like our laser treatments, more of our chemical peels. But as far as treatments that you can get all year round, I would say Hydrofacial is a really good one. It is a medical treatment where we can exfoliate the skin, really cleanse deeply and refresh the skin. You walk out of the clinic completely glowy, and there's no major downtime with that. If you wanted to do something a little bit deeper, but not have like any crazy downtime, I would say the BioRe peel is a great option as well. It's a formulated peel that's a 30% TCA peel. Usually those peels have some downtime, but this one specifically kind of mitigates like you having to stay out of the sun. You can still work out. You don't really have to make any crazy changes to like your day-to-day routine. But the treatment actually does include 4 sessions. So you come in every 7 to 10 days, and this is going to help target acne, texture, pore size, hyperpigmentation, even redness. So this is great for like sensitive skin types. So I love that it's like very inclusive on all skin colors and all skin types as well.
And then filler and tox. You're right.
Yeah.
You're right. How can you not? That is a must. We do have another question here. This one is from Charisse. And Charisse is asking us, do you get the same results from Sculptra and filler? So I know we kind of talked about that in the beginning, but if we could kind of tap into that a little further, I think that's something that a lot of people wonder.
Yeah, I think so. Sculptra is a little bit of a patience game. So you kind of have to know going forward that once the treatment is done, it does take a little bit of time to kind of build out that result that we're looking for. Typically, you can start to see improvement in the first month, and then going forward, you'll start to see improvements month 3 through 6 as well. And Carly can kind of add on to this. Sometimes we'll also incorporate hyaluronic gels intermediately while the Sculptra is kind of brewing or cooking, if you will. So they kind of work synergistically if you want them to, or you need more immediate result, but you can still benefit from a biostimulator as well.
Yeah, filler is going to give you more of that instant gratification for sure. Sometimes if we're really trying to build like mimic bone loss that happens as we age, filler is going to give you a quicker response and get you a faster response. And then after that, we can go in with the Sculptra either before and after really. And then Sculptra is going to be more of that long-term investment in your skin. You're going to get that collagen growth. You're going to be in like hyperstimulation mode of collagen for 6 months. Some studies will even show up to a year after that Sculptra treatment.
So think of it different ways. Think of that Sculptra as, again, long-term collagen investment, really anti-aging, jumping ahead of the collagen loss that inevitably happens as we age. Collagen, fat, and bone, we can really mimic with Sculptra. And then filler is going to be a faster result for sure.
But we like both.
We love both.
If that helps.
It really just depends on like your.
Sculptra is definitely on the hot list today because the Sculptra questions are just flowing. I mean, here is another one we have. How soon after lasers can you do Sculptra? So explain the timeline, ladies, of, kind of where do you start? Do you start with laser and then Sculptra, then laser, and how soon after can you?
Sometimes Sculptra with laser, Sculptra topical with laser.
So you can use topical Sculptra with laser, but we typically recommend doing heat-based treatments first. Mm-hmm. So anything like Clear and Brilliant, CO2, anything that involves some heat, we would ideally lay down the heat treatment first and then inject. But it could be as soon as a week after your laser would be totally fine. Mm-hmm. As long as your skin is doing well. It's just the topical numbing cream sometimes can irritate fresh lasered skin. So more perfectly ideal, maybe about 2 to 4 weeks after your laser would be even better if it wasn't a timeline crunch.
Perfect. And actually, this just came in as we asked this, and I think this is great to kind of tie in. But is there a bigger benefit to injecting Sculptra versus applying it topically?
Definitely injected. You're going to get more collagen boost. But we do love topical. So a lot of the times, say Tati will do this as well. Sometimes we do it with CO2 after your laser microneedling. We'll apply some Sculptra superficial, like on the topically after those treatments in order to get it in the top layer of the skin. That's going to kind of calm the skin down really nice, enhance your glow even more after treatment. But really, most of that true collagen growth is when we're going deeper into the skin and injecting it.
Yeah. Awesome. Let's see what else here we have. Someone here asked, what is the difference between a chemical peel and just a regular facial, like hydrofacial?
Okay, so the hydrofacial, like I mentioned before, that's like a no downtime treatment. We're able to like do extractions during that appointment time and just really hydrate and kind of focus on like balancing out the skin. And you walk out of the office completely normal. You can wear makeup that night, go to an event, kind of go on with your routine completely normal. And then a chemical peel does require some downtime. So usually when you come into that treatment, we go over the aftercare with you, but basically we put the chemical peel topically onto the skin. And usually with our peels, they stay on your skin for about 2 hours and you wash it off at home. Typically, we're sending you home with an at-home regimen, so you'll know exactly what products to use. And usually the healing process is anywhere from 7 to 12 days, depending on how much dead skin is accumulated. But you really want to avoid the sun during that healing process, but the results are worth it. I see some of like the best before and afters with our chemical peels. You just kind of have to wait those days out, but it's definitely worth it.
Yeah, it's definitely a good one, that's for sure. Another question here that actually this is something that I feel like a lot of people ask and don't actually have a clear answer to. So I'm excited to see what you guys think about this one. But what is an alternative treatment to eye filler? Someone said here, I'm really scared about getting eye filler, but I have terrible under eyes. What would you recommend?
Well, there's a couple different treatments that I think, depending on obviously your main concerns. One, making sure what exactly you're trying to improve. Some people have dark circles, some people have texture, some people have maybe a little bit of like a protruding fat pad that can cause a little bit of what almost looks like swelling underneath the eye area. But there's a couple different things that are great, like Thermage Eye is great for tightening. It's good for fine lines. with no downtime, which is great. There's also injectable PRP or PRF that can be placed under the eye for brightening, enhancing, kind of almost like fertilizer under the eye area. I would say probably Thermage Eye, injecting PRP or PRF are probably the top two. CO2 eye obviously is a little more intensive. And then maybe Carly can chime in on filler under the eye area. It is a very, very, very tricky area to treat and get the best outcome. It is a little bit finicky, I would say.
It is. You want to be more cautious with that area. We treat it all the time, but a lot of patients are moving more towards PRP, PRF just for those reasons. But I'll say a lot of the times this happens weekly, that patients come in for a consultation or a treatment and they say, I want my under eyes fixed. And we can, so many times it's really mid-face volume loss that they're dealing with. So I always say that mid-face area is like your shelving support for the under eye and for most of the face, honestly. So if you're flattening through there, which is one of the first early signs of aging, we start flattening in that mid-face cheek area. If we can support you in the mid-face, so much of the time we don't even have to touch your under eyes. There are, like Jill said, there are times where if volume loss is an issue, we may go in with, say, PRP, PRF, or some conservative under eye filler. But I love seeing the result that we can get when we just enhance your mid-face. You see those improvements, not just in the under eye. Your nasolabial fold will lessen. The lower face looks improved because we're just treating the early signs of bone fat loss that inevitably happen to all of us as women as we age.
Awesome. Perfect. So we just got a direct message in on Instagram, and I just had to share this because I thought this was so sweet. But someone said, you guys are also professional and well educated. I am very, very impressed. I have to ask, how many syringes of cheek filler do you recommend? So I know that's kind of a tough one to answer because everyone is different, but on, regularly, what do you guys see in terms of cheek filler?
I think I would say more often than not, 2 syringes is a pretty good starting zone for the majority of people. 1 is probably not ideal. There's not a whole lot of volume amount when you're kind of dispersing it between 2 sides of the face, right? So I would say 2 syringes, possibly 3 if you're very, very volume deficient in the mid face, but I would say 2 would be pretty consistent across the board. Yeah.
Let's take a look here and see what other Q&As. I'm kind of juggling both what we're getting on direct message on Instagram and here. So let's kind of tune back into our Q&A here. Someone here just asked a good one. I saw someone thumbs up it, so we have questions on it. Here we go. Does Botox stop working over time?
Oh, good question.
That is
a really good one.
Resistance is a really hot topic right now. In rare cases, it can, but it's not with everyone, for sure. I think there's a lot on like TikTok and Instagram right now about it stopping working. The biggest things that you can do to decrease your risk of Botox, Dysport, Xeomin to stop working over time is really sticking to the intervals that we recommend to you. So we always say every 3 to 4 months. You never want to retreat before that 90-day mark because your body can grow antibodies to the tox. There's options that we try to do everything to mitigate the risk of that. Sometimes it's kind of, I always tell my patients, maybe we need to confuse the muscle a little bit and change the product. So if you've consistently been doing Botox for a really long time, let's try Dysport or Xeomin. And kind of, again, like keep the muscle on its toes and confuse it. They're very molecularly, they're very similar products, but there are still differences. So I find that to help mitigate. And the biggest thing is just not doing your treatments too often. Really give it that 3 to 4 month interval in between to decrease that risk.
And then one other thing, I think, remember dose does also equal duration, right? So when we tell you this is what I recommend for the dosing, the appropriate amount of units per area, you really need to try to trust your provider as much as possible, because underdosing, right, cannot be great for longevity or keeping that toxin there as long as possible. So I know it can be challenging sometimes with pricing and those types of things. It can be difficult trying to stay within a certain budget. That too, we try to do our best that we can to work within that. But just kind of understanding dose does equal duration. So if we're not dosing you as high as we would like to, that could also contribute to it not lasting quite as long as you would like.
We have another one here, and this one made me laugh a little bit. This one's an interesting one. I enjoy this one because it's a little tricky, but I can back this one up. Someone said, what is the hype around hydrofacials? And I do, hydrofacial is one of our most popular treatments. And so, Tati, if you want to kind of chime in on this one, but what makes hydrofacial so special?
Yeah, so I really like the hydrofacial because it's basically this machine, and so it's going to get a lot deeper than I can just with my bare hands. It combines different serums in different steps. So we start off with like a deep cleanse. It helps exfoliate the skin and kind of soften up the pores before extractions. And then we can really customize the treatment with different boosters. This is where we can tailor it to your skin. So if you're dealing with pigmentation or acne, or maybe you're wanting something more anti-aging, this is where we can choose a custom booster, and it's really going to help target that concern. And then we finish off with antioxidants and hyaluronic acid, and that really helps to plump and protect the skin. And so you walk out of there with really glowy skin. So this is a great treatment that you can do all year round, or in between like your other treatments that are a little bit more intense or have downtime, and it's a little bit easier kind of to fit into your schedule, but the results are just great and you look amazing afterwards. So I think that's why it's a favorite in the clinic.
I love that. Yeah, it definitely is a popular one. It's one of my favorites for sure. But you can't go wrong with a nice hydrofacial.
Definitely.
Mm-hmm.
I love it. Another question that we got here, let's see, is how does radiofrequency skin tightening work, and what areas can it target? So I know we kind of reviewed this in our segment before the live Q&A, but if you ladies want to just kind of tap into one more time what the benefits are of RF, what areas you can treat and so forth.
Yeah, so we have two different devices in the office that have radio frequency. Our first one is Thermage. This treatment has been around for years, and we have the latest device, which is the FLX. This is a non-invasive treatment, so we're not penetrating, we're not cutting, we're not going into the skin directly physically, but it's basically emitting the radio frequency heat and penetrating into the deeper levels of the skin to stimulate collagen and elastin. And so we can treat like upper face to kind of, if you're more concerned with the eye area, there's a specific hand piece where we can go on the eyelid and on the lower very safely. We can also treat lower face and the neck area, which is a concern for a lot of people because we start to see kind of this area kind of with gravity kind of pull things down. And so it's a great preventative treatment, but also corrective. It's a great treatment to start doing in your 30s if you're starting to see a little bit of like that laxity coming in. With the Virtue RF, this one's going to be a little bit, has more benefits. So we can target laxity, and I really like to treat like acne scarring or even surgical scars, or I don't know if you guys saw on the before video, the abdomen, like after having kids, a lot of women deal with their skin just like not bouncing back. And so there's more texture. The skin's a little bit more loose in that area. So we can treat the body as well. So belly, above the knees, even the arm area, and obviously the face as well. So I love it because we can get, this one's a little bit more invasive, but the downtime is very minimal. So typically you're maybe a little bit red the first day, but within a couple of days you're back to normal. And that's done in a series. So the Thermage is a one-time treatment, and then the Virtue RF, we split that up into 3 sessions. But yeah, it just depends on the patient. Like usually we'll have you come in, and depending on the area that you're wanting to treat, we can kind of decide between which one would be like best suited for you.
I love that. All right, let's see here. So we only have a few minutes left of the Q&A. So if anyone has any other questions, we just please ask that you roll those in now. We have time to answer about 2-3 more. I do have one here, and this might be a me question, but I'll let you injectors chime in as well, but it will make me feel special for a second. In regards to Beauty Bash specials, you purchase different fillers for different areas and get the discount. So yes, you absolutely can. But injectors, I will kind of let you tap into the beauty of mixing up kind of, or I shouldn't say mixing up, but using multiple syringes during one treatment for fillers.
Yes, we definitely can do as much as you want as far as at any given time. And don't stress too much if you feel like maybe you didn't choose the exact filler that maybe you were thinking of. These can all be interchangeable. There might just be a slight price variance, usually not too much, if at all. So don't worry too much if what you picked may not be the perfect fit. We can always kind of swap that product out as well.
Yeah, and you can always reach out to us. We have some patients that will send photos in. We have a text line. You can reach out. We all have Instagrams and everything. Reach out to us. We can always get you in for consultation while we have the Beauty Bash deals going, and give you an idea of what you will need. I mean, in-person consultation is obviously best, but we have ways to give you ideas of what you might need.
Absolutely, yeah. We are always here to support. We're always here to answer any questions. It's as easy as sending us an Instagram message, a Facebook message, an email. So please do not hesitate if you do have any further questions. But on that note, our time is coming to an end. So Jill, Carly, and Tati, thank you so much for taking the time today to answer everyone's questions, fill everyone in. We had so much fun getting everything answered. And in the meantime, if any other questions do come up, again, please feel free to either direct message us on Instagram or Facebook, email us. We will be letting out a pre-recorded version of this, or a recorded version, I should say, of this virtual event so that you guys can go back and watch and share with your loved ones. But that is all for today. So thank you again for chiming in with us and spending your evening here. But again, as the girls said, do not hesitate to reach out to us if you have any further questions.
Thank you. This was fun.
Thank you.
Until the next one.
Wait.
Thank you, ladies.
Thank
Thanks.
you.